Hi and welcome to the Passion and Possibilities video series for women preparing for motherhood. And I'm Charlotte Cagny from Birth Essence, and I support women to be confidently themselves as they journey to motherhood. And today I'm interviewing Arty from AMarisa. Arty, welcome to my interview series. And Arty, as a short introduction, you have a wonderful business where you support people with reflexology, with matrix imprinting, with back flowers, with EFT, many modalities, and you also support your husband's business. You're a very busy lady with lots of passion, and I'm really pleased to speak to you today about the ways that you support pregnant women when they come through your business.
Thank you, Charlotte. Thank you so much for having me here today.
Yeah, it's really great. So I know you do so many things, and there's so many things we could talk about that are all so useful. And when I met you, it was through reflexology, which I came to you when I was pregnant. And I found it so beneficial for myself. And I wondered if you might tell us a little bit about reflexology and how it can help people, because I don't think everybody knows about it.
Okay, so reflexology is a very ancient therapy. It originated back to ancient Egypt, so it's since time was created in a way. There's a lovely little painting that is found that you have people like rubbing each other's feet and hands. So the theory is that the different body parts are mapped. They're like microsystems, so it's mirrored on your feet, on your hands, on your face, and your ears. So it's like a mirror, it's like a reflection. So when it was actually created, there was no local anesthetic. So by actually putting pressure on certain parts of these microsystems, the feet or the hands, you could numb that particular area of the body that surgeons, the so-called surgeons, wanted to work on, and just basically the link was created. And gradually it kind of evolved and to what it's known as today, what it is, reflexology. So that's what reflexology is. It's the body parts which are mirrored on different microsystems. And then the benefits, well, the benefits legally are stress reduction. That's what we really say. Research suggests it's more stress reduction. But then, as we all know, all kind of different imbalances and illnesses are stress related anyway. So you feel relaxed, you can sleep better, your mood, you feel much more happier. It's a general well-being treatment. More clinical trials are being done to be able to create this evidence for other kind of areas as well, like pain reduction as well, maternity. So yes, that's what reflexology is in a nutshell. But I think you need to experience it.
I didn't realise there was the legal thing. I'm familiar with that with essential oils and things, where the benefits that are known anecdotally and by everybody that uses them are much wider than you're legally allowed to say. Is that essentially the same with reflexology? So you're legally allowed to say the stress reduction, and you're so right. Stress is like at the root of so many, particularly in labour. If you're stressed, you can't release the oxytocin, and so then it shuts down. But it's also at the root of many other illnesses, and rest is certainly very underrated in pregnancy as well. We need to rest more. And so yeah, that's interesting, because I think there's far more than, I think that I can say it because I'm not the legal, but I think there's a lot more than just the stress that is benefit, from my personal view and others that I've heard of, that it can really support and treat many conditions, one of which is to align when the baby's ready to come. I know people use it when the baby seems to be staying a long time in the womb, and they don't want to have an induction with the chemicals, and I know reflexology has been used successfully that way. And also I have a few people I know who were struggling to get pregnant who've come and used reflexology for fertility as well. So it's got a very wide application.
Yes, definitely, because it's easily accessible as well. So as to kind of reinforce what you've said, in terms of having that due date as such, I think that's something that we may be discussing as well. It's always a date, isn't it? Rather than it's when the baby is ready. So reflexology helps not just during that time, but ideally it's good to have it like during your much before your due date. So you're in baby, you're able to kind of assist the baby to come when they're ready.
Yeah. So when you're working with someone, do you feel the energy through the feet? Do you have set places, or do you move depending on what you sense?
Yes, so with maternity, with any kind of reflexology, whatever. So when somebody comes to you for reflexology, in this case for maternity reflexology, there's certain areas that you apply this gentle pressure, or which, depending on what is needed. So if you think about the foot, the inside of the foot, where the big toe is, at the side where the ankle is, that's where the uterus is. So usually there is sensitivity, and you can feel the energy in that area. And then in terms of fertility on the other side, which is where the little toe is, the fifth digit, towards again the ankle side, you've got the ovary. So those are the two main areas, and below that is the pelvis. Well, below in the inside is the pelvis and all the reproductive organs as well, in terms which help with the actual labor and giving birth.
Mm.
So that's the main areas. But then in terms of pregnancy as well, it depends as well on what symptoms you come with. So when you come for maternity reflexology, the kind of consultation process is first of all to see that if it's safe for you to have reflexology, which mostly it is, unless there's other complications. But then you wouldn't be coming to reflexology in the first place. So it's
serious complications. Yeah.
But you work together. So there are times that, if there are any kind of issues, we can always liaise with the midwife and check and just make sure that everything is comfortable. But yes, it helps also with the initial stages of nausea. Sorry, just to kind of retrace there, because I've done the fertility reflexology as well. So a lot of people have this kind of misconception again that reflexology is it's contraindicated in the first trimester because it may cause a miscarriage. Now, reflexology will only do what is natural for the body. So we're not stimulating any points that are going to cause miscarriage. And in the same way, people don't like to there's not enough proof how the real effect of reflexology. Nobody wants to kind of create the links between the beneficial points of reflexology, yet they're so quick at saying reflexology may cause miscarriage.
Yeah, so that's an interesting thing I've never thought of. Yeah.
Exactly. So if you can't say it's so amazing, why would you want to say that it's going to cause all these problems? It's a contradiction in itself. So, but anyway, the points that I've learned through my training will actually increase the chances of the embryo to stick to the uterus and blood flow, together with some yoga exercises as well, and the breathing. It all helps you as a mother to tune in, just to nurture your baby. So there is no, if a miscarriage is going to happen, it's very rarely that you're causing it as such. It's just the natural process of the.
Yeah, my understanding is most miscarriages are happening because there's a problem with the baby. Your body's recognised that, and there's nothing you are going to be able to do. There may be some where perhaps you're overdoing it or stressful, and you can realign the energy, and then it'd be a benefit. You'd be benefiting the woman. And I have the same thing with massage. A lot of massage practitioners, which I do some, won't treat in the first trimester. And I do. And then as an insurance, whether your insurance company's covered it, but essentially people I think are worried that if there's a miscarriage, people will say, well, it was after I came for the massage, and it's not actually a cause. And it can actually be supported through the massage. I don't know if it's the same for reflexology, that in massage there are points of like release points on other areas of the body more that then support the energy to flow out, or to support you, just to have that emotional support. And I came to you when I had a miscarriage for reflexology, and found it very soothing to be in your presence. So there's the presence of the practitioner, and to have dedicated that time to me to say, you are worth this, you matter, and this story matters, and you took care of me. So in a place where I was having a difficult time, you were taking care of me, and you were looking after my feet. There's a lot of love involved, I think, when you're touching someone's feet. There's, like you said, a lot of ancient history in many cultures of touching the feet and paying that respect. I know from some of my friends in other cultures that it's quite a big thing for them to touch the feet of somebody else, when I've been in Thailand and other places. And so there's this honouring aspect of going to someone for treatment whether at any time. And when I came to you for miscarriage, it was really, really soothing before you even touched my feet. And then the benefits also on my feet and then through the body. So have you found that when you were working?
Yes, so I've actually, I do a lot of, I do try and support a lot of ladies that have gone through a miscarriage, stillbirth, abortions, and termination, so to say, in a natural or in an artificial way. It's something, I think the main thing, and this is what I'm really glad you experienced this, is that a lot of people, when they hear the word miscarriage or losing a baby, there's a lot of stigma associated with it, and there's a lot of blame, self-pity. Rather than all of that, all a woman needs at that time, which is what I try my best to do, is create a non-judgmental, safe space for you to feel nurtured, for you to feel in tune with your body. Because a lot of times that, you know, if you're going through a silent miscarriage and you want to release that naturally, the reason why you're not able to do that is because you're holding on energetically, emotionally. You know, there's so many things happening within yourself. So even though mentally you're saying I want to let go, or whatever the reasons are, whatever you're feeling, you're still in a very subtle kind of realm. You're not willing to let go. So by touching your feet, by the aromatherapy, or the relaxation procedures, or I think you went for acupuncture as well. So all of this is to support your energetic field, which sometimes, well, not sometimes, always is more powerful than your physical. That's the real you, isn't it? I think sometimes we're very confused about, you know, who are you anyway? But that's something else.
I think we can see and touch and feel the physical, so we're more familiar with it. We know how that works a little bit, but we are not, it interacts with the other energetic realms, and we're not so, in our culture, we've kind of been trained out of that. And I think what you do with reflexology brings some of that back in, and that's why people aren't always sure about it at first, because the more standard medical that they're familiar with isn't so confident at, like you said, saying what the benefits are, or confident with it. Certainly in this culture, in others it's not the same. But
I always think that if you want DNC, you would go to a doctor at that time, isn't it, when you're having a miscarriage? But you choose to come to a complementary therapist because you want to try and give your body the best chance to let go naturally, without medical intervention and without the it's quite traumatic for you, and maybe even the soul of your baby. You just don't know what's happening at that time as well. But reflexology is a fantastic blend because there's a lot of like scientific evidence which allows us to be out there. But then it's what you said, you need that relationship with your therapist where there's non-judgment. Even unfortunately, even within practitioners, there's still a lot of stigma associated because of the fear. You know, what's going to happen, whether you're going to sue you know, there's a lot of like legal issues as well. Whereas if you genuinely want to care for somebody and this love and this kindness, or just simple humanity of compassion, that's all you need.
I think it's really important, both in miscarriage and in general, looking after yourself, that connection and community, because we can be isolated when we become mothers, and having that community during pregnancy. And there are so many things we could talk from just this small little part, and I'm really glad we started talking about miscarriage, because it's again a conversation that can be hidden, and so many women experience miscarriage. I don't really know hardly anybody that hasn't had at least one if they're planning a family or have many children, and it can be hard to talk about and painful even years later. But if you don't do anything to address that, it's more painful and harder. And then I know for myself, with other illnesses that have been through my family, when I've occasionally spoken to people who are not comfortable with death, with pain, with any emotions, they freeze when you tell them something uncomfortable, because they don't know what to do, how to comfort you. And there's nothing really you need to do. You just need to say, oh, I hear you, I'm listening, I care.
Okay,
and that's what the person needs, to be able to be like, this is happening to me and I'm still okay, I'm still loved, I'll get through this. That support. And that's one of the things you offered really well for me when I came to reflexology. So the benefits of reflexology and the benefits of that support from someone who could be in a stronger place while I was in another place.
So I'm very grateful you came.
No, it was lovely. And just in case anybody watching isn't very familiar, that silent miscarriage is when you have a miscarriage where the baby dies but isn't released immediately by the body. And most miscarriages release naturally straight away. And it's still beneficial to come because the energy realigning your body, releasing energetically in the grieving process is very real, and it can be short or long. Some people, particularly an earlier miscarriage, they can bounce back and be fine very quickly, but others find it much harder, perhaps particularly if you've tried very hard or a long time and there's a big disappointment for whatever reason. And in my case, and another interesting thing is, in my case, I did eventually go to the hospital for support, and then I had so much of the complementary support, and for me that was a strong step. And it's not like an either or, but it was like talking to my body, the process of spending a lot of time with myself and the baby and the body, so that I was really ready when it did eventually release. And I think that can help when you go to be pregnant again, that you've cleared out your systems that you mentioned coming throughout pregnancy anyway. Like, I think it's a really good thing to do to prepare the way for the baby to come in effortlessly and really be fully present with you.
Yes, and it's quite nice as well, because you've been giving one of my clients, I was giving help to conceive in the first place. She carried on her pregnancy, and now I see her with a little boy. And a little boy, or even when I hadn't met him, he already kind of identified me because of that connection in the womb, which we don't give much importance to. We feel, oh, how are they going to remember? But they do.
Yeah,
that's amazing, isn't it? That's the best part. That's the best time. Sorry.
Yeah, that's really wonderful. I think it's amazing that we can help people so much by touching the feet, by pressing, and it affects the rest of the body. And that's really helpful for because, as you said, they're accessible.
Yes, yeah, of course.
Yeah. And would you recommend people to, even if they don't know about reflexology, but to support each other, just massaging the feet without knowledge, or do you have to have the specific knowledge?
So I would say initially in the first few stages, like the first two, well, you can just apply pressure on the sole of the feet. There's no kind of points that are contraindicated there. So just a general massage with the intention as well. And if you're a bit apprehensive, don't put too much pressure, but just stroking everywhere. Just a lovely little like massage with a like, with a lovely kind of oil or whatever you feel comfortable, whatever medium you feel comfortable. And it's more setting that time aside, as you said, for self-care, for yourself. In terms of doing the reflexology as well for yourself, even trying to combine it with the breathing, because the breathing helps you to relax. So in the middle of the foot, I'm just showing you in the hand is the solar plexus, and just massaging your hands or the actual foot area. That also just helps. Or another really good thing to do with your partner is just ask your partner to hold your heels with your both hands. So it's a little bit like it's a pelvic hold, and it kind of when you're being held. Like that, even though you're being held on your feet, it's your whole pelvis area that is supported, which is really soothing. I think you had mentioned it in your blog as well. When you're going through the labor, your partner's trying to help you sometimes. It just depends on the situation. I don't think there's a right way to do it, but you just want to feel, as you said, heard and held and loved.
I'm going to try that. I didn't know that. I'm going to try that. I'll ask him time till I'll report back to you. But I can feel already that being held in the pelvis, that's a very, like, the root of you, like from a chakra point of view, the root chakra, survival, stability, grounding. And we need to be grounded in pregnancy because we're kind of going up and out to meet the baby, and we're very open and vulnerable in a lot of ways. So being held in that so that we can go out in this opening way to welcome the new baby, to be held at the same time, is really important, I think. And that's why things like these treatments are so good. I think we're covering my questions without me even looking at them and asking them so far. So what do you love most about when you're treating women who come to you for maternity reflexology or maternity in general?
Well, I think it's a two-in-one, isn't it? You think
Mm,
you're just kind of giving this lovely reflexology treatment and just this kind of well-being treatment to the mother, but you're not. It's both, and
mm,
I think obviously it depends on the session. It's nice to chat with the mother, but when we have a little bit moment of the silent moment where the mom is really relaxed, and
mm,
it's just nice in a way to have this silent conversation with the baby as well through the feet, and just to kind of, again, the intention is that you're safe, that your birth is going to be really nice, your first kind of impression of the world is going to be a beautiful positive experience. So it's actually maternity reflexology is really rewarding, because in a way you feel as a therapist that you're making a difference to the future, because if you're able to create a positive birth or contribute towards a positive birth, it is a positive world that you're leaving behind. Because right from birth, whatever happens at your birth, kind of, as you very well know as well, and you help with this, it just makes such a big impact on your entire life. If your birth is full of medical intervention, there is a high likelihood that you'll constantly be needing that medical attention for different reasons. But if you're able to kind of create that environment to increase the possibilities for a natural homecoming, so to say, or welcoming, it just feels nice. So that's what I really like about maternity reflexology, and I think you need to pamper a mother.
yes.
Uh, and I love that. I really enjoy having that opportunity to make somebody feel special. There's more happiness and pleasure in giving than in receiving, and there's more pleasure and happiness in giving for two rather than just for one. So
Mm. It feels
that's
like
what I.
giving for three, really, because you're giving to yourself. It sounds like
Yes.
you're giving to yourself, and then it's like a mutual benefit. Um,
I couldn't agree with you more. Uh, you were saying how special you felt when you came to me. I
mm,
think I felt more special than you because of your trust in me. That's what I find fascinating with my work. Not only reflexology, but even the EFT and the batch flowers. When somebody comes to you and they open up like a book with no reservations, and they trust you, that
mm,
trust very empowering for the therapist's self-worth as well,
mm,
which is wonderful. Or no training, no coaching, nothing can give you that, which is what your clients give you. So who's helping who, isn't it? It's who, that energy interaction is quite powerful.
Yeah, it's lovely, and I think it's an important point that when women are choosing who to support them in birth, to choose who they feel comfortable with and who they trust. So and it's the same whether it's in labour or whether it's in pregnancy. There's lots of studies scientifically done to show continuity of carer didn't so that right through the pregnancy and the labour gives the best results, because the woman will feel safe and can talk, and the other woman knows her. And I think that's really important. And when you're choosing, say, different people to go to, sometimes you can't find what you want, but sometimes there's a lot of choice on which practitioner, and just choose with your instinct and who do you feel comfortable with, who do you just feel drawn to go with, because it's not a head. We're so used to thinking with our heads. We're so often trained to do that and to rationalize this is a good reason because this, and birth and labor aren't like that. And generally I think in life the head decisions that work best are the ones that are aligned with your heart and your gut, to say this is going to be right for me. I can't even tell you why, but I just know it. And learning to use those, like the head and the heart and the instincts together to make choices, I think is really important. And I know you're very intuitive and you've talked about that, and I think it's a skill that um, isn't used enough, isn't valued enough in our society, and that when we do, the world opens up more. And so you're using it as a practitioner, but I think women use it to choose who to go to as well, and then you have a better experience over and above the qualifications, but that connection
Yeah,
between human beings.
but you need the qualification, you need the kind of
Yeah.
constant to be out there as well,
Mm-hmm.
because I think it's a bit of both. I completely
Yeah.
agree. Your intuition is
Yeah.
important. I think because we are still in this physical world, we need physical modalities to be able to access and go in. Uh,
Mm-hmm.
we need to be very aware, because it's so difficult to learn a physical modality. The intuitive modality is like even more impossible, isn't it? So use it with discretion.
Yeah.
And we have this power of discrimination anyway, so we
Yeah.
need it's a very big responsibility to take when somebody calls you and somebody wants to create this relationship. And that's why sometimes it doesn't work out. And if it doesn't work out, it's important to say this on the onset, that it doesn't seem that this relationship may not kind of, it's not beneficial. So let's just leave it.
Yeah, and you can choose again.
And you can choose again, yes. Or refer on. There's been times that I've not been able to fit people in, and I've got other practitioners, other friends and colleagues that I'll refer on. Because you need to be at the right, when a woman comes and books an appointment, it's just not, it's a relationship you establish. So if both of you are not in the right place, you can't do it then.
Yeah, I think it's an important point to make, because I hear many women in the system, the NHS, thinking they just have to accept whatever's told to them.
Yes, exactly.
You question just as you would in any other modality, anywhere you went. If you were at the supermarket and something looked off, you wouldn't just go, well, I have to buy it because it's being sold. You'd go, no, I don't want that, I want this. And we're a bit indoctrinated in Doctor Knows Best, when they have the individual person may have your best interests at heart, but they're not you. So they can't know. You can ask for, like you said, they have certain qualifications that has certain information that's useful for you. So you can ask questions, but the ultimate person to make the decision is you. And I think that's very important.
That's the thing. That's what reflexology and these and your treatments as well help with, to empower the woman to give her that kind of knowledge, and not even knowledge, just to be able to give her that strength, that inner strength, to trust her instinct. Because a lot of times, because we trust the doctors so much, which is a very good thing, especially in pregnancy, because you don't want to risk anything happening to the baby. But still, in a controlled and safe manner, if you feel you're not comfortable doing things, question it and ask for an alternative. And usually the alternative is accepted, but because we don't have the ability to be able to ask, we don't get what we want. But if you don't ask, you will not get it anyway.
No, yeah, you're very right. It's empowering women to feel they have the right to ask, and the right to be taken seriously, the right to be heard, and from that inner place to actually do asking and questioning, because so much of our society has been created and is changing right now, because what we knew then was incomplete. There's been quite a focus on the mechanical side of how things work, without the full understanding of all the interactive systems, so the energy as well. And so it's, when taken from that point of view, and a risk-based approach, it's not the full story. So asking questions and being strong enough to say, I want more than just, oh, I've come out of this alive. I want to have a good experience as well, really valuing that. And I want to feel whole inside as well as physically. The physical is important, obviously, but that is something I'm seeing a lot. Women are starting to really ask for more and be supported in that strength.
Of course, and ask for choices, alternatives. You'll always want a second opinion anyway. So what in pregnancy or giving birth, it's the most important part. It's the birth of your child. So yeah. what is going to be more important than that?
I know, definitely. So what do you love about birth itself, just generally, if you're thinking about a woman giving birth, and when you see people come through who tell you their stories, and what inspires you?
I think what inspires me is it's like, for example, your own birthing, isn't it? When you kind of allow yourself to remove yourself out of it. When a woman is able to remove her kind of egoistic self, so-called egoistic, so to go into your natural state, your primitive state. And it's just beautiful when women have managed to do that, to tune in and have this beautiful birthing experience, and they come and tell you how relaxed they were, or just the whole kind of the awe of bringing a new life, and being able to be still in that moment, to be able to experience that without having the obviously, if the baby is in distress and you need the medical intervention, it's very important. But just the whole kind of experience of holding your baby after kind of going through that tuning in process, which I think is fascinating. And what we were saying before, to trust that your baby knows when is the best time to come and how, because I feel that's already decided. It's just a matter of allowing it to happen.
Yeah, yeah, and that can be both in a natural birth and in a cesarean birth setting. The one thing that people worry sometimes when they come to me with clients, they worry when they learn more, they think, oh well, I didn't need to have that cesarean, or it could have been better. But when I say there are reasons perhaps your child has chosen that we can't know, and you can't change what happened, but you can change the way you felt about something that was traumatic to you at the time. My own entrance into the world I experienced as a bit traumatic when I was born, but I've changed the dialogue with that so that I can see now what wasn't good maybe, but what was also good, and I just dropped the story around it. So it's what happened that isn't a problem anymore. And I love that little baby me that went through that challenging time, and then I've taken what happened there and used it. And it's part of what's motivated me for this business. And yes, it does shape how you show up in the world, and it can make certain patterns that you have. I think everyone comes in with patterns that they're working to change, and patterns that are like their strengths already. And so that birth experience gave me a certain set. For example, I was breech birth, and so I kind of like to do things my own way, even if it's harder. That doesn't bother me whether it's harder or not. It's like I want to do it my way, and I think that's one of the reasons some babies choose that. They're like, I'm doing it my way, thanks. I'm doing it differently, a little bit, not the same as everybody else, and that'll show up again and again in ways they do later on in life. I think it's quite a fascinating area of study. A little bit off topic today, perhaps, but a fascinating area of study that I see in a correlation with the work I do with people.
I agree. I agree. I myself was a cesarean baby, and I'm quite insecure in a lot of ways. But then I'm doing all these therapies, especially the batch flowers, walnut. I have got so much support in a natural way that my birthing experience, even though it was a negative, but it was still a cesarean. That I feel that the more people you help in other ways, you kind of heal yourself.
Yes, yeah.
It's wonderful, as you were saying as well, as we were talking. It's just a community. We're just there to support each other.
Lovely. Tell me a little bit about the batch flower remedies. I know it's something else you use.
Yeah, so the batch flowers is they're different. There are 38 flowers that were created by Dr. Batch, and so they actually relate to emotional states. So when you're going through emotional upheaval, you just take these. They're remedies, so they're diluted, and you take 4 drops 4 times a day, just to kind of help you get back to your balance and to your inner peace, so to say. They're completely natural as well. So you can take them during your pregnancy, even while giving birth, even to your baby. So there's no kind of secondary effects, and you can take them alongside allopathic medicine as well. So they're very subtle. One of my clients said they're very subtle, but yet very powerful. So it's I think most everybody's heard about the rescue remedy, which you take during exam. Yeah, so that's 5 flowers. It's a combination of 5 flowers which just help for that kind of trauma or shock. But there's much more. There's 38 in total, which correspond with every human emotion, and it's that combination. You can make a bottle up to 7 of those remedies, which is again tailor-made for you. It's more self-care, self-help. So I'm a practitioner, but there's so much information available as well online that you can choose your remedies, and I can make just the bottle for you as well. So it's not, the consultation is more like it's a talking therapy. So you're just trying to find out, why you're here, what's the reason of your problem, and then you make it accordingly.
You have the experience to choose the right flower for the person based on what they're telling you. And again, that meeting with someone is so important, where you're hearing them and you're asking questions that they discover things they didn't know. So yes, I agree, you can go and do it yourself, and there's a lot of benefit in seeing someone just to hear yourself answer questions. You discover things you didn't know and get a deeper realization, and then the flower works with you. I think that's really interesting. And I like this little gentleness of using these kind of remedies.
Yes, and it's the onion peeling process as well, is what you just said as well. In the consultation, the first consultation, something might come up, and then you take a bottle. When you come for a consultation, the bottle lasts for 3 weeks. So when you come again after 3 weeks or after however long you need to come, there'll be the onion peeling process. So another layer will come up that you didn't even realize was there until, it keeps evolving. So it's a kind of opportunity for you to realize yourself.
Yeah, yeah. I think that's really.
It's very empowering.
Mm. I think it's great, and I think these kind of therapies are coming more popular. And I think I was talking with somebody else for another of the interviews about the land and about the connection with nature. I think we've lost that a little bit, and we are animals too. And many of the allopathic medicines like paracetamol and so on, they come from plants originally, and we forget that, and we think, oh, but that's scientific, that's a scientific one, and we forget that the plants are right outside our door, and there's so much knowledge lost with the witch hunting that happened, where a lot of the women who had the herbal knowledge, who had the plant knowledge, who had certain knowledge were killed off. And so there's a lot of still historically passed down diminishing of that type of medicine, and it doesn't work in the same way. And also it's the whole plant or the whole flower that's being used may work in ways we're not really sure, and I know that with the scientific, what you're allowed to say on the benefits, because it's not so easily measurable perhaps, but still hugely beneficial. And I love that it's a way of bringing us back in connection with the natural world, in a way, the power of the flower, the identity and energy of the flower that's working with your systems to bring you into alignment. Because we all know, I think there's probably a lot of studies that people are more familiar with, that if you walk out in my windows over here, you see the trees, green areas outside, it slows your metabolism back down to the natural world, and that you can have a lot of health benefits that have been shown with people that are in a city area that don't see greenery, and those in a city area that do. And I think the flower remedies bring some of that healing in, as well as their individual flower essence, just the fact that they're part of that natural world brought in. I don't know what you think about that. That was just my feelings as you were talking. Can you hear me? You froze a little bit there.
Yes, I just froze. Yeah, I can now.
Oh, good. Did you hear what I was saying? Okay.
I did. Yes, yes, I did.
Good. You can never tell with the technology. We're talking about the natural world, and the technology is going, hey.
We need both.
Yeah, we do. It's all right, computer, we need you too. Because we couldn't talk to each other otherwise. But yeah, I do think it's been a bit neglected, the natural connection, and I think it's a good way.
Yeah, and with the Batch flowers as well, it's not only physical. So Dr. Batch believed in the emotional response.
Yeah.
So how does the illness make you feel? So by treating the personality, you kind of help balance the illness. So that's okay. So being natural is good as well. So it's got the natural effect, but it's more how you react in an emotional level.
Yeah, which we think is very important. Yeah, and it's partly a neglected area. I think the emotions aren't always considered when we're in a doctor setting. And it's hugely important. You can feel so much better when someone just asks you how you are. And it's often the emotions you're answering with. If someone says, how are you? You don't describe the physical without the emotion, because it's how you feel about being ill that is very important to how you deal with it as you're getting better. Or I know in pregnancy you're not ill, but as a general thing. So yeah, that's really interesting. I have taken Batch flowers a few times, so it's making me feel like taking them again. I'm taking some other flower remedy at the moment.
And the good thing is you can dip in, and when you need it, it's there to support you and doesn't create a dependence. So it's just nice to have them around when you need them.
I think we have just a little bit more time. Would you tell me just a little bit about the matrix re-imprinting? I think it is you also trained in. That sounds similar to something I do. I'd love to hear a little bit more.
So I do it alongside EFT, which is emotional freedom technique. So it depends what somebody comes for. So with EFT, it's more like the problem, and we tap on the meridian points. And with the matrix, once we kind of identify a limited belief, we go back to the earliest memory you have of that kind of belief. And there's the echo, which is your younger self. So you actually start tapping, or you start talking, however you want to call it, to your younger self to help recreate a new kind of memory, and to re-imprint your beliefs. And this helps you to empower yourself with more the positive kind of aspect to that memory. So, and then you can't keep re-imprinting, so to say. So that's the aftercare. So you're reinforcing that positive belief. So first you identify, what is it that's causing your problem, your suffering, and then you look back at the earliest memory you have. You kind of go back into it, tap on yourself, and then you come back as a renewed self, so to say.
So do you find
it's very simple
show up differently afterwards, where they're reacting differently to that events that might have triggered them from this old belief? They show up differently. Is that how it works after? Yeah.
Pretty much, yes. It's of course it's different layers that come out, and it depends how accessible things are, isn't it, and how willing you are. It's one thing coming to be kind of helped, and then the second step is actually willing to go in, isn't it? So it's that balance. So yes.
Yeah, it is similar in some ways to what I do, with finding how there's so many different ways you can find what's been set up that's not serving you now, and just make that change to something that is serving you now, because we always know what we need or what we want on one level. And it's lovely to talk to you, and you do different modalities, and you I guess you combine them, or what people come to you for. But yeah, it's really
it's everybody's at a different kind of level, isn't it? Even though people want to feel better, it's your commitment to change. Some people are wanting that happiness, but they're not willing to make those changes. So it's slowly coming through different ways, and then finally being able to get there.
Yeah, that's wonderful. So I know you see a lot of different women when you're working from different places and different backgrounds. And recently I've been having a conversation with a few different women about the discrepancies of outcomes between people from different backgrounds. And there was a report recently, the Embrace report, which is mother and babies. I wrote it down yesterday. Mother and babies. It's to do with it's to do with morbidity, and the outcomes were Black women 5 times more likely to die in pregnancy, and Asian women twice as likely to die. And that I know in our society, women are already as a gender kind of, there's this, what's the word? I've gone blank. So women already as a gender having poor outcomes in certain areas, but certainly, obviously, it's mainly women it's women in the pregnancy that the Asian women are more likely to die than the Black women. And they're quite shocking statistics that this goes across all the socio-economic boundaries. It's quite hard to pin down exactly why that's happening. And I wondered if you had any thoughts on what you would like to see change, or what you think we could do about that. It's a bit of a difficult question to throw at you, but it's been something that I've seen starting to happen in conversation, the acknowledgement that that is a thing that exists still in our society, that there are different outcomes for different groups of people. And we'd like to think that wasn't there, but it is.
I think again, it's who you're asking the question. Everybody's going to have a different take on this. I always feel that you have a certain amount of control over your own well-being. So I think it's all about taking your own responsibility. So the only thing that I can kind of, in terms of the government and in terms of the services provided by the hospitals and the medical care, that's something completely different. And I don't think I'm in a position to be able to comment on that. But what I would like to see within these women is just it's more self-awareness. And as we were talking before, if you have the knowledge, you can dictate the terms, how you're being treated. So I think it's all about, I would go back into like tuning in yourself, knowing what your baby wants, knowing what you need as well, because the resources are available. It's just you knowing what you want to get out of them, and just being strong enough to be able to stand up to what you believe.
Yeah.
So in terms of things changing, my little contribution would be to do a little bit more yoga, to do a little bit more of self-awareness, the self-breathing, that just to empower you.
Yeah.
I think I mentioned this to you before as well, just as, there's a lovely, I do pregnancy yoga as well. And there's a lovely, Yeah. So this is a lovely book called Mother's Breath. It's actually not in print, so if you can get hold of it, it's a very nice. Again, it's very well explained, and it's self help on how to kind of do the breathing and tuning in with your baby, because um, their child, dying while giving birth is something that, if it's meant to be, you can't avoid it, but you can increase your possibilities to have a pleasant experience, to kind of survive it, again, by natural methods. It's a very primitive state. So if you're able to go in and tune in and be, not be affected by what's happening around you, even though you may be in a medical institution, or even if you are having a cesarean, it still can be quite positive.
Mm.
And how you kind of you are during your pregnancy. So
Yeah.
I don't know whether I answered your question
Yeah,
or not.
I think what I'm hearing is that no matter what may be happening externally with systems that have got inherent biases and there are problems out there, that there are recognizable problems, and to change, a lot of the change starts within. So start there, empower yourself. And we're talking about the breath. That's a very powerful thing to use, and essentially a call to stand up. And it's a way of not allowing yourself to be placed in a victim box that, oh well, I'm in this bracket and I'm as well. So looking out there and putting the blame out there, and even though the onus, I was talking about, the onus shouldn't be on the woman to make the system change, at the same time it's a great call for all women to find that strength in themselves, because we are strong, and no longer accepting any dialogue that we're not strong, or that we can't do this, or that we, as you would teach your children, you can, we are. And you spoke earlier of the transformation as you become a mother, and that's the kind of transformation, and you're changing from one place to another, the strength that comes with that. And I think that's what you're pointing to, that go inside and practice breathing or different modalities, and seek practitioners to support you, but have that determination, and you can do it. Like, they encourage that you can do this, irrelevant of how difficult it is. Because there are realities out there that can make it more difficult for certain people to do, and that is going to change, and it needs us all to stand up, and it will change. That's what I'm hearing. Is that right?
Very well said. Because if you're strong yourself, you deflect that preconceived ideas people have about you and your race. It doesn't really matter. At the end of the day, we're all human, we're all equal, and we just have to believe that, in a way. Even though somebody might be quite negative towards us, if you're positive, your positivity will deflect that negativity. And again, people use different things. The reason why I said breath is because you don't even need to go to anybody. You're breathing. You're just about tuning into your breath, feeling that empowerment, feeling that stillness, and that in itself will create that little bubble around you, which will protect you and nurture you at the most important part of your and your baby's life.
Breathing is a very simple and very important thing, because it's so easily accessible. And I notice myself, if I'm under stress or duress, or like you said, something's happening externally to take me out of my place, I notice I might hold my breath, or I'm not breathing. And then so an immediate shift from your place is to breathe again. If you can remember to go breathe. I wrote a whole blog post on this once. Just breathe. Start there. And you're pointing at that. It's actually more powerful than you might think. Change your breathing and change your state of being.
It's simple. You don't need anybody. You just need yourself. Half the time we're not with ourselves.
Yeah, that's true. So Arty, I could probably talk to you all day. It's been really lovely chatting to you. But if there was, to finish, if there's one thing for the women listening that you would love them to take away as they're journeying to become mothers, what would you leave them to reflect on, or to like them to take away with?
Well, I think it's just to enjoy their pregnancy. And one of the wonderful ways to be able to enjoy this is, again, I'm just going to show this, one of my favorite kind of things is to journal. So if they can get a good journaling book, and this is just one of them, it's just to write your thoughts, take time out for yourself. When we try and develop a business, we go to a coach, or we try and have a teacher to kind of guide us. So just use yourself as a guide. Have that time with you and your baby, create that bond. What really, the special time about pregnancy is this is the time that you're closest to your baby. And if you can create that bond by talking to your baby and trying to see what the baby needs, and just spending time with your baby. I know that that you feel that that there's no interaction as such, but the baby does listen to the mother. So it's just kind of creating that time, that one-to-one time with your baby, and just that stillness, reflecting, writing. So it's a gift to yourself and to your baby.
Yeah, enjoy. I like that, just the word enjoy, to remember
Enjoy.
to enjoy. And like you said, you're always present with your baby when you're pregnant, that they're always there, but to be focused, take time to really focus on that. Not taking for granted is not the right word, but we forget because it's always there. So enjoy, however that is for you. Enjoy is such a wonderful place to leave our interview, really, to enjoy, because I've had fun doing these interviews, and I think, yeah, and my last pregnancy was so much fun, and my son, my third son, is a bundle of fun. And he seems to enjoy himself looking at all this craziness going on with his brothers, his older brothers, rolling around on the floor, and he just laughs. And I think, yeah, I really enjoyed my third pregnancy. I really looked after myself more than I had in the others, and I had an independent midwife who looked after me, and I had so much fun. And so, yeah, that's wonderful advice to take away for me as well.
Yes,
Enjoy.
and you created that relationship with Musa. You had that relationship, so that's why you have a fun-loving baby. If you
Yeah,
maybe if you didn't do that, that wouldn't be the case.
I
You
think I
you
needed
you
more
commit.
fun in my life, more enjoyment. Yeah, and it passes so quickly. Everyone says it, and until you're there, you don't really appreciate it, and life seems to pass by. But taking that time to enjoy, you've got those memories that can sustain you. So yeah.
Definitely. Well, thank you as well, Charlotte, for having me here. It's been great. Thank you
Yeah,
for the
thank
whole
you.
conversation.
It's been so wonderful. I look forward to connecting with you again soon, and I hope everyone that's listening has had a really lovely time. So this is Arty and Charlotte saying goodbye.
Thank you.
Thank you.